Hello, and thank you for tuning into our Facebook Live Q&A, where we'll be discussing how to keep yourself and your community safe as we continue to navigate this new normal. I'm Elizabeth Van Camp, and I'm a member of the UI Healthcare social media team. I'm joined by hospital epidemiologist and infectious disease expert, Dr. Jorge Salinas, who will be answering your questions about the still present risks of COVID-19. So please submit any questions or concerns you have now, and we'll answer as many of them as we can throughout this live. Thank you for joining us today, Dr. Salinas.
Very glad to be here.
One note before we begin, this video is for informational purposes only. So if you feel sick or are concerned about your health, we encourage you to contact your primary care provider or schedule a video visit to speak to a provider. So Dr. Salinas, you're a hospital epidemiologist. What role does our epidemiology team play in this pandemic?
We advise hospital administration, hospital leaders on how the epidemic or the pandemic is evolving, where it would go in the next few days and weeks. We help our institution plan, create protocols to maximize safety for our patients, our employees, and visitors.
Great. And so we've got an infectious disease team. What exactly do our infectious disease team members do?
So we have an infectious disease division within the internal medicine department. We are a group of clinicians and researchers that we see patients. We provide treatment advice to patients that may have COVID or not. A group of us is investigating how COVID is behaving, investigating potential treatments, vaccines. Our infectious diseases division is very much working to try to find a solution to this pandemic. And a large group of people are in our division work in epidemiology, trying to understand how the epidemic is behaving, who is being affected, why are they being affected, what interventions could be the most effective in halting the transmission of this virus.
Thank you. And yeah, if you haven't seen them yet, we just started a video series with Dr. Salinas' team, and it's called Epi Explains, and we're going to be doing a weekly video breaking down COVID-19 and all the concerns around the pandemic and precautions that you should be taking. So we've already posted 2 of those videos. Make sure to go back in our timeline and check out those and get the good information from that team. So our next question is a more personal one. How are you and your family coping with the changes the pandemic has caused, and what changes have you made to your daily life because of it?
Yes, I think that the summertime is a good season to try to forget about all these worries and be in the backyard, playing with the kids, enjoying our very warm weather these days, playing with water. With the hose, with the kids. So that's what I try to do, is spend my afternoons with them. We eat ice cream. Sometimes we drive to a small town nearby, Kelowna, and we go get some ice cream, eat it outdoors, and then drive back. Some days we've gone strawberry picking. Again, all sorts of outdoor activities that we can do that are still safe and that kids can still enjoy. So that's what keeps me busy. I went to see the 4th of July fireworks in Coralville. Very nice. From our car, we opened the sunroof. My daughter was up there, and she loved it.
Oh,
so
nice.
There are ways to still celebrate, congregate, but safely.
Yeah, thank you for those reminders and just giving us a little glimpse into what you're doing to cope with this, because I think everybody's doing it a little differently. But I agree, this week, if you're not using water when you're outside with the temps, it's a hot one in Iowa.
Yes.
So I'm hoping that maybe you can help settle an argument that's been floating around on social media in the past few weeks. Are COVID-19 numbers rising simply because we're testing more, or is there truly community spread in Eastern Iowa?
Fortunately, our testing capacity as a state and as a country had improved over the last 2 or 3 months. It is true that very initially in March, April, the United States didn't have sufficient testing capacity. That has fortunately resolved. Nowadays, virtually everyone that has COVID symptoms or that may have been exposed to COVID can be tested. And we've had that capacity now for a number of weeks. So the recent uptick in cases in our county, in Johnson County, is not due to that increase in testing capacity. It is confirmed that there is ongoing transmission in the community, and that transmission has been linked to socialization in venues that predispose to increased risk of transmission. But it's so understandable. As I mentioned last time we met, after a long winter and the pandemic, all we want is to be close to our friends again, socialize, go out. So we need to remain smart and being able to do it in a conscientious way. We can still socialize, we can still go out, we can still see some people, but we just need to modify the way we do it a little bit. And if we do so, we'll be able to continuously do that over time, over the next few months. But if we go all out and we try to pretend that we're back to 2019, before COVID came to Iowa, that's not going to last that long, unfortunately. And before we know it, we're going to have to hunker down, and we're going to have to see more restrictions in our liberties. So I think that it is a good bet to invest a little bit in how to socialize safely and how to go about our lives safely with some smart modifications, so we don't have to pay a much heftier price down the road.
Yeah, absolutely. So on that same topic, when people need to go to stores or other public places, what are some things that you want them to remember to do that safely?
So I think that going to the store is relatively safe. As much as possible, you should perform hand hygiene, soap and water, or you can have some form of hand sanitizer before you enter and touch the cards, etc. You should always have a face covering on. As we've discussed, there are so many ways, so many options for face coverings, masks, shields. There are even hybrids. There are shields that come with a baseball cap. You name it. You can find a way to protect yourself and others with a face covering. So some hand hygiene, face covering, and going there and do what you need to do and leave. Try not to socialize with everyone. Try to maintain some distance when you're in there. But I think that going to the store is safe. Everybody has been doing it. And I don't believe that going to the store has played a major role in the transmission of COVID in the United States.
Thanks for that info and those reminders. So there's some new reports out this week which highlight the damage COVID-19 can do not just to our respiratory systems, but our vascular system as well. Can you explain this finding to us and talk about what that might mean?
Correct. COVID-19 is a group of illnesses, almost a group of manifestations caused by the introduction, the infection caused by the virus called SARS-CoV-2. And each body is different, and each body reacts to that viral infection differently. Some people will only have a viral phase, a viral infection, similar to a cold. Some people will have a sore throat. Some people can have a pneumonia, an infection of their lungs. But in some individuals, that is then followed by a more inflammatory syndrome. Some people, even if there's no virus left in their lungs can remain affected. They become fibrotic, hardened by the inflammation caused by our body's response to the virus. In part of that inflammation that can happen in the lungs can occur similarly in other organs. Our vascular system can have a form of inflammation, and patients can have clotting. They can develop clots more easily. Some people, not everyone that gets an infection by the SARS-CoV-2 virus can develop clotting, but some patients do. Some people develop a very robust inflammatory response that can sometimes be detrimental to your own health. So in some people, our immune system overreacts and can cause us to feel very sick, to require hospitalization. So every day, every week, we learn more about the behavior of this virus and in its interactions with our bodies. So yes, it is true that it can cause respiratory syndromes, but it can also cause other inflammatory syndromes in many organs.
Great. So there are a lot of theories floating around on the internet and even in discussions in our community about whether face masks actually cause or do more harm than they do good. Could you help us better understand the following concerns? And there's 3 of them. The first one is face masks hold in CO2 and restrict oxygen intake. Is that true?
No, it's not correct. There are now many videos, TikTok videos and whatnot, demonstrating how people can maintain a normal oxygen level even with a mask on. So no, it's completely not true. What is true is that sometimes it may be a bit harder to breathe. You may have to take a bit of a deeper breath. You may feel short of breath. But the good thing is that your oxygen levels don't decrease because of a face mask. Now, there are certain people that may have COPD, that they may be on home oxygen, or they may have a heart disease, that may have shortness of breath at baseline, and perhaps a face mask can become a barrier. It can become difficult to wear, and that's where you have other options. You can wear a face shield. At the end of the day, the objective is to have source control, meaning that when you cough, talk, or breathe, the small droplets that we all produce will be caught by a barrier, be it a cloth mask, a medical mask, a face shield, a respirator. Any of those face coverings will help prevent the possibility of me passing on the virus to others, even if I may not feel sick.
Sure. So one other thing that I just read just yesterday was that even if the mask or the shield forms that barrier, your breath is still getting out, and your breath could infect people. That's not correct, is it? It's the droplets, right?
Correct. Correct. So this virus is predominantly transmitted via droplets. It is possible that especially when we speak or sing, more so when we cough or sneeze, that we produce droplets of many sizes. And there are droplets that can be smaller, and they can become problematic when we are in very crowded indoor settings. So if the one good example would be a club. You have a lot of people very close to each other. Music can be loud. After a few drinks, you also get a little bit louder. So if a lot of people are doing that, those small droplets that are usually negligible, they don't play much of a role in transmission. But if everybody is speaking very loudly, then they can become problematic. And that's why lately we've been recommending people to avoid being in large crowds, but especially indoor crowds.
That makes sense. Thank you for explaining that. The second concern that I was hoping you could clear up for us is, do face masks trap toxins and then force you to breathe them back in?
No, that's not correct. The human body is fantastic, the human machine, and we have ways, we have mechanisms to compensate and to maintain an equilibrium in the number of toxins, CO2, oxygen, etc. So no, it's not true. Our healthcare workers use masks all the time. Our surgeons use masks the entire day when they are operating on people, and they're very healthy. So no, it's not true that it leads to accumulation of toxins. It just becomes slightly harder to breathe when you have
Sure.
a mask on. But I think it's a small sacrifice that we all make so we can continue having a relatively normal life otherwise. But
Yeah.
if we don't have a face covering, COVID will continue spreading in the community, and it will cause more harm to us in the end.
Absolutely. So the last concern that I'd love to run past you is, do masks increase your risk for catching the virus? That's another theory that's out there.
Correct. One of the ways that this virus gets transmitted is if we touch secretions, for example, and then we rub our eyes, nose, or mouth with our contaminated hands. There is this theoretical concern that perhaps if you have a mask on, you may need to touch your face more often. But there are ways in which you can touch your or put it on or off or take it off without having to touch your face. You remove one and then the other ear loop, and that way you're not touching it. Try not to accommodate it that much. If you wash it often, the recommendation is to wash it almost once a day. If you wash it often, it should not increase your risk of acquiring COVID. But what we know for sure is that if everyone wore a face covering, it would end the pandemic. Is that powerful? Now there are studies, researchers from England have modeled and calculated what would happen to the pandemic depending on the percentage of the population that wears a face covering. And if a large proportion of the population, more than 80% of the population, wears a form of face covering, the pandemic would end.
Oh, that sounds like a dream.
Imagine that, right? But it all it takes is for all of us to agree on making this small sacrifice,
Yeah.
so we can go back to life, our normal life sooner.
Yeah, absolutely. Wow, that's incredible. I will be hammering people even harder about wearing face coverings now that I know that.
Yeah, I mean, for some people we need to hammer it down. For some, we just need to try to persuade them. And the good thing is that there are just so many options.
Yeah.
And if you want to socialize with people and you really don't want to wear a face covering, if you can be outdoors very far from other people, if you go on a hike, let's say, in the middle of the fields and there's nobody around, yeah, you don't have to wear a face covering there. So if you intersperse these activities throughout your day, so you don't have to wear a face covering all the time, especially when you're off on the weekend, you're going to feel good. When you're at work, if you work in an office, if you're likely to encounter many people, if you're then you will need to have a face covering on. After a while, I think that it becomes comfortable, as I mentioned the other day, with face shields. Sometimes I forget I have them. I have it on. And sometimes masks can be very comfortable too after a few minutes.
Yeah, I agree. I bought a face shield about a month and a half ago, and I forget it's on when I'm out until somebody stops me and says something about it, like, where'd you get it or something. And it's very comfortable, and it makes me feel like I can connect with others a little bit better because I know they can see the facial expression I'm making and what I'm saying. And I feel like I can see them a little easier because I'm not worried about my mask. So I agree. There's something for everybody out there in terms of face coverings.
Absolutely.
So if you're just joining us, we're here with Dr. Jorge Salinas, an infectious disease specialist here at UI Hospitals and Clinics, talking about your health and safety during COVID-19. Please leave your questions and concerns in the comments below, and we'll get to as many of them as we can. So now we're going to answer some of these questions that people have been submitting on social media. Sabrina asked, do you recommend people wear a face covering out in public, even if they know they'll be able to keep at least 6 feet of distance between them and others?
So again, if you're going on a hike or you're in a very large park, you don't see other people around, you may not need to have a face covering.
Okay.
If like my children, if you're the first one in the playground and nobody else is around, it may be okay. to not have your face covering on. As soon as you see other people, getting closer, you would have to put them back on. But that's why it's so important to always carry face covering with you.
Yeah. Trisha asks, can you speak on whether children are big transmitters of the virus or not?
There is some evidence, but we're still learning. At the beginning, we thought that children could not get sick. That's not true. They can get sick. They can get COVID. They can also transmit it. They can develop cough as adults do. So yes, they can participate in the transmission of COVID.
Okay. Coco asks, after being out in public, what are the precautions we should take when we come back in our homes so we don't bring germs in with us?
One of the key interventions, and the easiest one, that's what I love about public health. Our interventions actually can be simple but very effective. One of the best strategies is hand hygiene. As soon as I get home, I wash my hands. I know that at the beginning of the epidemic, people, and in my home country where I was born in Peru, people created very cumbersome protocols. A physician, used to exchange clothes 3 times before entering his house, and I do leave my shoes by the door, but yes, you just do hand hygiene, and don't bring your shoes in, and you'll be all right. Nowadays, there is more research being published, and it is believed that contact is not as important as a route of transmission of COVID as compared to droplets. So do frequent hand hygiene. If you know that you've been in contact with people that have COVID, if you work in a healthcare setting, etc., yes, it's advisable to change clothes, etc. You leave your work clothes, somewhere before you go on with your life. You don't want to go hug your children with the same clothes that you were using to treat patients, let's say. But for most of us, when we go to the store, etc., your clothes will not get contaminated in a meaningful way by just walking around to go get your groceries. So just frequent hand hygiene, and maybe don't bring your shoes into your house.
Yeah, and just clean off your shield or toss your mask into the wash. Is that correct?
Absolutely, too? Absolutely. Your face mask should be washed ideally once a day, and your face shield also. And one way, the other day we talked about coming up with habits. People sometimes have habits. If you wear glasses, for example, you have a habit of cleaning your glasses once a day before leaving for work. You can do the same for your face shield.
Great. Shannon asked, if people I know have been out in public without taking precautions, how long should I stay away from them to be safe?
So if you know that, let's say a cousin or somebody that you know is following risky behaviors or has been around people that may have COVID, perhaps you may want to stay away until they change their behaviors. So you want to hang out with people that are following similar precautions. If it's a relative, let's say now for the holidays, some people have received visitors from other states that have a higher incidence of COVID. So yes, those individuals have a greater risk of carrying COVID even without knowing it. So the same principles apply. We should all work under the assumption that anybody that we encounter may have COVID and may spread it, even if they don't have symptoms.
Right.
So try to maintain some distance from those people, wear face coverings, wash your hands. If you're going to meet them, do it outdoors if you can.
Okay. That actually touches on another question we got from Facebook from Julie, which is, can you speak on asymptomatic spread and how that works? Like that someone can have it, not know it, and go spread it to others just by going to the gym or sharing food with someone.
Yes. Now is it's very interesting. It was a bit hard to get to that knowledge. Initially, we thought that we knew that asymptomatic people, people without symptoms, could pass it on. Then we thought that no, really, that's not that important. But nowadays, science is like that. It continues evolving. It continues changing, self refining.
Mm-hmm.
And now we know that people without symptoms can pass the infection to others. They can be as infectious as people that don't have symptoms. And that's why everybody should have a face covering to try to prevent spreading it inadvertently to others. Um, but the way of transmission is still by being in close proximity. If I am near another person, and then my droplets go and land in their eyes, nose, or mouth, that's how the virus is spread. You're not going to get COVID by walking down the aisle in your grocery store, and because somebody with COVID walked down the aisle 30 minutes earlier, symptomatic or not. That's not usually how this goes. Um, so yes, don't be worried. If your neighbor has COVID, don't worry. It's not going to float in the air and come enter your house. If somebody that may have had COVID went to the grocery store, 15 minutes ago, and you walk down the same aisle, don't worry. You're not going to get COVID that way. COVID is transmitted truly correct through the air. Droplets travel through the air, but it has to be in close proximity, especially if it is in a closed environment indoors, where air is not moving that much. Outdoors, lots of air movement, that risk decreases tremendously. So I don't feel worried at all when I go on walks or hikes. Um, so at any rate, I hope that helps.
I think that answers the question really well. And I'm glad you brought up the fact that science is kind of evolves, or some of the stuff we know changes, because I think a lot of people have been confused by information, and part of that is just because it doesn't always get reported the same by news outlets or on social media. But I think the other thing is that just because it seems like sometimes we find out new information about the virus weekly. And so what do you recommend for people to make sure that they're staying on top of the most reputable and accurate information about COVID-19?
I would follow the web pages from the CDC, the Iowa Department of Public Health. Usually our public health agencies will take enough time to process all the information, not to jump to conclusions right away as soon as a paper is published, or a news article is published on Sunday. So oftentimes in science, I know that people get confused, or sometimes people say, well, Dr. Fauci said this or that, and he's changed his mind.
Right.
Rest assured that scientists like to prove their colleagues wrong. So among scientists, we're always trying to investigate and confirm or refute whether the current knowledge is correct. So, and then public health is on the side and is watching that debate. And once the debate starts settling, once most scientists start agreeing that when they do a study after the other, and they see the same findings, then it becomes more of our common knowledge, and then public health starts implementing those recommendations. That's what happened to universal face coverings, for example. There were some concerns about it, but more and more studies came out, and then now there is consensus that is one of the best strategies to try to halt this pandemic. So yes, you will see an article going in one direction or the other all the time in science. That's what you want from science. You want skepticism. You want them to be trying to prove each other wrong. But eventually, at the end of the day, all scientists end up agreeing once study after study starts showing the same facts.
That is great insight. Thank you so much for explaining that to us. Angie from Facebook asks, what do you really recommend for little ones as school resumes or when school resumes? I have a 5-year-old with asthma, and this virus makes life so tricky to navigate.
Yes, I know. I think that COVID can be especially hard on children. It has prevented them from socializing, and they really like playing with others. I think I recognize that COVID poses tremendous challenges to the idea of reopening schools. I think that our public health agencies are coming up with recommendations to try to do or take a calculated risk. Going on with our life increases our risk. The only thing that has zero risk is staying home and not ever leaving. Other than that, going to work, going to get your groceries, going to school is a little bit of a risk. So, but for every risk that we take, we need to take measures to try to mitigate it, to try to contain it, to try to prevent that risk from getting out of hand, to be too big. So our public health agencies are coming up with recommendations for schools on how to reopen, but safely. And it will have to do, and from today until the time that schools open, there are a number of days and weeks. It's not that far away, but in COVID days, it is like an eternity. And my point is that the recommendations for when schools open will have to do with how much COVID is circulating in the community. So it's convenient to all of us to try to bring down the incidence rate of COVID in Iowa. So when children need to go to school, the risk of transmission in schools is decreased as well. If there's no COVID circulating in the community, there won't be COVID being transmitted in the schools. So that's one thing. We need to do our best to decrease the incidence of COVID in the community, and schools need to follow protocols. Some schools, depending on the age of the children, etc., will implement a form of face covering. For example, either masks or shields. Will try to distance within the school. Will try to do outdoor activities as weather permits. There will still be some form of tele-education, for sure. So we just need to continue being creative, and there will be hiccups. Know that. Don't expect that come August, okay, we're done. Children will go to school for sure. We'll have to readapt. There is the possibility that there could be an outbreak in one school or the other. The school may close for a week or two and then reopen, and we'll just have to continue with our lives. Again, there will be some risk. As long as the risk doesn't get too high, then we will be able to continue with our lives. About now, for children that have underlying conditions, that for children in whom COVID can be a threat to their life, children or adults for that matter, I think that their modifications to their daily life will probably need to be more robust. And I am positive that your school will find ways to work with you to adapt to your needs, and perhaps some more of tele-education will be used for people that may be at a higher risk.
Right. So Rachel asks, what is the outlook for a potential vaccine? Like, do we have a timeline, or do we know what the future of that looks like?
I am optimistic. There are dozens of vaccines being tested now throughout the world. And I am optimistic that one of them will have some effectiveness. Again, the best vaccine is a vaccine that you get one time and gives you 100% protection forever. But that may not be the case with these, at least with the first vaccines that will come out. We expect some to come out next calendar year in 2021. And yes, they may not be super effective, but perhaps if they decrease the severity of illness, that would be tremendous. It could help us continue reopening our society, understanding that even even though the vaccine may not protect you 100%, if you do get COVID, your risk of hospitalization or death would be much, much lower. So yes, I'm very optimistic. I'm hopeful that early next year we will start seeing the first vaccines being deployed. But again, that is still somewhat optimistic. The science of developing vaccines is a very rigorous one. Vaccines have been under scrutiny for a long time. And the people working on developing these vaccines want to ensure, number one, that they are safe, that they don't cause side effects, and number two, that they are effective. Once those two things have been proven, then a product will be released for public consumption.
Great. Mary asks, the virus seems to have mutated again. Will it mutate again? And if so, how might that affect how a vaccine will work?
So something that we all need to understand is that almost or all forms of life, and even though a virus, there's debate as to whether a virus is live or not. Let's pretend that it is a live microorganism of sorts. But many life forms, or all life forms, evolve, change over time. Their genetic material changes over time. Your children are not exactly equal to you, and their children are not. It's the same with viruses. So it should not surprise us that the virus changes a little bit. The mutations that have been brought up in the press, these spike protein mutation, etc., there is no knowledge that this given mutation confers higher transmissibility or higher severity of the virus. So I would not be that concerned about the possibility that the virus has mutated. There are viruses that are just on the wild side. They mutate a lot, and they're pretty crazy, and they create a lot of trouble for vaccinologists, for people that develop vaccines. But the coronavirus doesn't seem to be that wild in the sense of mutations. So I don't think that at this point we know that any potential mutations that may happen to the virus will have a tremendous or will be a tremendous setback for vaccines. I don't believe that. I think still that the outlook is promising for vaccines starting next year, and I wouldn't be too concerned about some news about a mutation. Yes, viruses mutate.
Great. Thank you again for breaking down. You've provided us a lot of really great scientific information that I think can be confusing when we hear about it in the news, but you're presenting it in a much more understandable way. So thank you for doing that. One more question from Facebook that a lot of people have been asking is, with the knowledge that's in close quarters, the virus can, be spread by those little droplets. Not necessarily airborne, but kind of. Do you recommend a face mask over a face shield, or does a face shield do just as good of a job of stopping those droplets when they exit your mouth?
Well, there are so many things that we don't know. In science, we want to prove things and we want to do studies, etc. We have not yet conducted a study comparing a form of face covering to the other. There are just many types, makes, models of face covering. I think that as a good friend of mine, Mike Edmond, says, the correct face covering is the one that people will wear. So yes, if you can wear a face mask, go for it. If you can wear a face shield, go for it. Again, use what suits you, what is more tolerable for you. But I wouldn't get into arguments about which one is better than the other. As long as you have a face covering, you're good. We can be friends.
That's great. Keep it simple. I love it. So my last question for you today, Dr. Salinas, is if people are having symptoms of COVID-19, what steps should they take?
So the first thing, well, I will start by saying that COVID can be tricky. In some people, especially if you're otherwise healthy, the symptoms can be very mild, can be a headache, can be sore throat, some mild cough. And so as soon as you feel that it may be coming on, or especially if you were in contact with somebody, so you kind of already know that you may develop symptoms, is don't go to work, don't go. So start isolating yourself. That's the first thing. Then call your doctor. Here at the University of Iowa hospitals and clinics, we have a protocol. People can call, schedule a visit, a telehealth visit. You can discuss with the doctor your symptoms, and if the symptoms correspond to the symptoms of COVID, they may recommend for you to get tested. And nowadays, we even do drive-through for some patients, and we can test you. But as soon as you start feeling that you have symptoms, it is best for you to start isolating and conferring with your doctor.
Yeah, and so if someone's feeling sick at all and they do need to come in, whether because their doctor after a telehealth visit told them to come in, or maybe they already have a scheduled appointment, we have a lot of safety precautions set up at the hospital to kind of help so that people know they're safe if they need to come, right? Can you talk about those just real quick for us?
Absolutely. The University of Iowa Hospitals and Clinics has a number of protocols, including the fact that everyone, healthcare workers and visitors and patients, need to wear a face covering when they are here in our grounds. Patients that have symptoms are placed into the examination room very quickly. Another good thing that may hopefully will help people to understand is that hospitals have air handling that virtually no other building in town has. The number of air exchanges that we have is much more than what usually we have in our homes. Our homes may exchange air for a fraction of an hour, or let's say one air exchange per hour, let's say, or less than one exchange per hour. In the hospital, depending on what activities are happening, in some places we have more than 20 air exchanges per hour. So you don't feel it, but I picture it as it's almost like a wind. You're not breathing the same air. If you're in a place 1 hour, the air you're breathing wasn't there 15 minutes ago. It's just another air. Again, we have a number of engineering processes to ensure that the air is safe in our hospital. Everybody is wearing a source control, is wearing a mask, preventing them from spreading droplets into the environment. We have a fantastic environmental services team that goes around and cleans surfaces several times a day. Your doctors are also very good at selecting and detecting which patient may have signs or symptoms of COVID, so they can be treated and managed in a separate clinic. So if you need to come to the hospital because of chronic medical conditions that require attention, I would feel very safe. We have more protocols, more precautions in place than most other places. If you feel comfortable going, getting your groceries, you should feel comfortable coming to the hospital.
Yeah, great. Thank you for touching on all those things. And thank you for sharing all of your other expertise with us today, Dr. Salinas. We really appreciate it.
Absolutely. Thank you. Glad to be here.
And thank you to everyone who tuned in. If you joined us after we started, please make sure to go back to the beginning of this broadcast to hear all of the great information Dr. Salinas provided us today. And stay tuned to our social media accounts and our website, which is uihc.org. Check out our Epi Explains videos, which will be coming out every week with lots of great information on how to stay safe. And make sure to follow the tips that our epidemiology and our infectious disease team provide to you. Lastly, remember to wash your hands, cover your face in public, and take care of yourself and your health. Thanks for watching.